Hello, and welcome back to our Care Coordination Minute, and this is episode 2. And as promised at the end of episode 1, I am going to go over CCM or chronic care management. Over time, you're going to learn a lot of this alphabet soup. So just to get us on track here, CCM came out in 2015. It's way down here at the very beginning of this arrow. So again, it is something that every primary care ought to be doing at this point in time. So we're just going to go quickly over all of the elements of CCM. So I have them all condensed into this one slide for you, and we're going to start talking about you do need to be using an EMR, which I don't think is a really tough spot at this point because most everybody is, although I have found some practices that are still using paper. However, if you are using a combination of an EMR and you also do some paper notes, that's okay as long as you do have all your demographic information, med lists, those kinds of things that are in an electronic format. That is acceptable. And then you can see that the availability to communicate electronically with patients, caregivers, and then you can see the next one is also community resources, referrals, all of those types of things. Now, that doesn't mean that if a patient is on CCM, they must communicate electronically. It just means you have to have the availability should they ask to communicate electronically. After hours coverage always is a hang up for some people. No, you do not have to be on call 24/7, but you do have to make sure there is some person that the patient can call after hours, weekends, holidays, those kinds of things. Most of the time, you can partner to get those services covered. If you're a clinic that's a part of a health system, super easy. You can use your emergency department. You can use any of those things because you can partner with that. Care plan access, which means developing a care plan, of course, and then making sure that there is access to that care plan for providers who need it in a timely manner. So there's nothing that's black and white any longer. Typically, this is primary care, and it is done under general supervision of the clinical staff. And we're going to talk a little bit more about that in episode 3, the clinical staff. So as we talked a little bit about in episode 1, typically Medicare's who started this, but there are other insurances who are now actually covering it. And it is for people with 2 or more chronic conditions that are expected to last at least 12 months or until the death of the patient, that if not managed, that's the next bullet, puts them at significant risk of death, acute exacerbation, decompensation, or any kind of functional decline. So, meaning you need to manage these chronic conditions. That's what chronic care management is about. It is consent based. The patient must agree to being in the program, and it does have to be initiated by a primary care provider, meaning that the primary care provider has to have an established relationship already with this patient. And time needs to be tracked for a total of 20 minutes per calendar month at a minimum. There's more to that as we go on later. So that's a quick overview of what the elements are of CCM. So I just wanted to say thank you for tuning in, and we'll see you on episode 3. And if you have any questions, please follow us on our Facebook page or our LinkedIn page. Thank you. Have a great day.